Hi, it's Catherine with educationalnurse.com. And this week's topic is about care plans in clinical. So, this goes out to nursing students and you preparing for clinical. I know this is the most exciting but scariest part of nursing and going to nursing school and actually dealing with real life people and not dealing with the simulations and pretending. So I have something that's called a concept map that kind of helps you put everything together that will make it easier for you to understand what's going on. Because as you get into more advanced nursing, you will be asked to do something of like a 30-page case report. Um, so for this, I kind of broke it down into a one-page thing to make life easier for you. So it's easier for you to carry things around and understand when they ask you to do a nursing diagnosis and how it applies to the everyday life. So first, I want to actually share with you the concept maps. I just got to pull it up. See? Okay. So as you see here, this is the concept map. So it starts off with the etiology and risk factors. Then it goes into the past medical history and allergies. This starts with what is the etiology and risk factors that this patient has and why they're being admitted into the hospital. So with their past medical history and allergies, what is within this criteria that makes them as risk factors for being in the hospital? The next is the social, culture, environmental needs. This is where I always say we need to level up. When we're looking at charts, you want to start with the ER, then you're going to go into the H&P, the history and physical. But in the ER, what brought them there? What is it that they got sick enough to come into the hospital? But this comes in with the Maslow's hierarchy of care and what the patient needs to be able to take care of themselves, because we start the discharge process as soon as they're admitted into the hospital. It's like something that happens right away because we need to know, is this person safe to go back home? So this falls into the Maslow's hierarchy of care. And I'm switching over to here saying, because a lot of students have issues. So by using this, nurses can prioritize your care, understand what is needed and most pressing and tailored to their interactions and interventions to support the holistic recovery and well-being. So this approach is only address immediate healthcare concerns, but also a broader human needs and significant impacts on the health overall. So this is where it's the psychological needs. How are their mental health? How are they coping with life, kind of thing? Safety needs. So this contributes to the safety needs and the concerns of the environment. This comes down to if there's an elderly patient who lives alone. You might find this a lot, that this older woman comes in or this man comes in and they use a walker, all the stuff, and you don't know how they function. Like they're not able to get up out of bed. So you're wondering, how are they able to function at home? Then it's love and belonging needs. So the nurse often spends more time with patients other than healthcare providers. So the social, environmental, and emotional needs comes in. So this fosters a sense of belonging and emotional support. You'll find that it's amazing that a lot of elderly patients, just having that one small moment with them and sitting with them and holding their hand or just listening to them goes beyond measures because they sit home alone all the time. You can just think about it like you're home alone and you have nobody to talk to. So what do? You pick up your phone and you start scrolling through social media, you make some comments, you may call someone on the phone. But you got to remember, older patients, they don't do that. A lot of them don't have social media or don't know how to use it, don't really know the computer. They're not tech savvy. So they sit home alone, maybe sometimes watching TV or just sadly wanting to belong to something. So that is why the emotional support for a patient is very important. And then this esteem needs. Let me just pause this. I don't want to be distracted. I apologize. So you can enhance self-esteem by encouraging patients to be independent as possible. But this is where you have to kind of be careful, because you need to know if this person is at risk for falls or any other issues. One of the biggest things is emotional needs and suicidal ideations. So when you're first assessing the patient and you're doing your admission head to toe assessment, that is part of the things that you need to ask certain questions. You'll get into this later when you're a nurse or when you're watching a nurse doing an admission assessment. If you have the opportunity when you're following a nurse around to watch them do discharge instructions in an admission, you'll see that all those questions are there. So when you hear about Maslow's hierarchy of care, it will start to make sense because it's bigger picture. It's not just picking something what you think of certain levels they're supposed to be at. And then self-accusation needs, excuse me, it's promoting, like, involving helping your patients reach the potentials that they need with the limited of what they have. So one of the biggest things that you got to think about is, let's just say someone has COPD and they're on oxygen, chronic oxygen, and they have that long tube. So it's you watching them and helping them navigate and go through the room that you're in, of like going into the bathroom or getting up out of bed and sitting in the chair. How are they able to do this? Like, are they able to do it with ease, or do they need help? And this is you using your nursing judgment. So this is where the NCLEX, which is the next generation one that's there, because we have found that we have some people who are really book savvy, but then when it comes into the clinicals and real life situations, they have a hard time separating. Then you have people who are average and aren't really good test takers, but they are excelling at the bedside. And it's like, how can I prove here? Because a lot of clinicals are pass or fail. So we had to change this to accumulate for everybody, because we realized too, is that we call a lot of nurses, the newer nurses today, I call them COVID babies, because sadly during COVID, you weren't able to come into the hospital. So you missed a lot. That's one of the reasons why I started creating this educationalnurse.com and helping bridging the gaps between all this, because I started seeing patterns when I was working the bedside and working with new nurses. Then clinicals and teaching, I'm an adjunct professor and teaching at the bedside and seeing the gaps. And then me doing legal nursing, I started looking at the charts, and that's something I'm going to go into a later video about care plans and how the care plans of what that 30-page care plan and how it actually comes to life. Same thing with the nursing diagnosis. They don't end. We teach you in school, and it's going to be in the concept map that I'm going to go over shortly, but nursing diagnosis, I use them in my reports that I write to lawyers to prove that the nurses know what they're doing, with the rationales of why they're doing something, the interventions that you put into place, and the patient teaching. All that stuff matters. Yes, you're learning it in school, and it does not go away. So at a later video, like I said, I'll go over all that, so stay tuned for that. But this is just a simple thing to help you get through school. So here is the concept map, as I was saying. So those social environmental needs. So this is where you're going to say, do they have a walker? Where are they coming from? Are they coming from a nursing home? Are they coming from home? Do they live at home? Who helps support them? So this is where the Maslow hierarchy of care kind of comes in. The next, as you see, is the medications. I know I'm looking over here. I have it up on my screen where you guys can see, so just know what I'm looking at. Medications. When you start listing out the medications, the one thing I could say with pharmacology, you'll have a separate class for that, but it's knowing the classifications of the medications. I had a case where this nurse came in to help another nurse just to pass meds, and she was just giving the meds, and she wasn't even thinking about how the patient was going to react to it. What are the measures that you need to take? She was being nice to the nurse and helping her out, but then sadly the patient had issues and ended up in ICU and needed to be intubated. Because if you are giving a medication that you know nothing about, you need to take out the nursing book and look at it. Don't just go in there and give it, because you need to know why you're giving it and what it's for, and have an idea of once you give the medication of what reactions the patient may or may not have. Because the nurse passed the baton to you to give this medication, so you need to be on the lookout for the reactions of it, because you are the one who administered it. You are the one who gave it, so you are the one who's responsible for it. So then at the top here, assessment, subjective, objective. This is where we get into our SOAP notes and subjective, objective. So subjective is what does the patient state? So when we write shift notes, I have a whole separate video on shift notes and the importance of writing notes and everything else, even if you're other shift, because the statute limitation for someone to sue is average about a few years. And you will have hundreds of patients that you won't remember. You won't. And the only way you're going to know is what you documented. And that's what you're going to say to them. What I documented is what I documented. So subjective is what is the patient stating? I feel fine. I feel this. Quotations. You need to mark out what the patient states. Objectives is where did you find the patient? On AIM assessment, patient found resting in bed. Patient found sitting up in bed. Patient found however the patient presented to you when you walked into the room. And then you go into the subjective. So then it goes into the head to toe assessment. So you got neurological, cardiovascular, respiratory, gastro, GI, GU, how do they walk, musculoskeletal, integumentary, that is the skin. So my other thing I have here, let me just find it, is the head to toe assessment. So this is what I have created. It's a whole pack. If you join the New Nurse Navigator, you will get the whole packet and this. So this is just a little cheat sheet that I have my students walk around with them to help you know what you need to do for the head to toe, like walking in and helps you. Some of my students shrunk it down into something they can put in their pocket. But here we go. So wash your hands, put gloves on. Number one, I have learned that you need to put gloves on because you go in and you see a nice little person smiling, whatever they are, and sadly, they're incontinent and you don't know it. So then next thing you know, you turn around and the patient is covered in feces and you have to clean them up. At least you had the gloves on. Okay. Introduction, you're going to introduce yourself. Who are you? The purpose of why you're there. You have to help relieve any anxiety that they may have. You can't just walk into a room and start doing stuff because that's assault. And then once you put your hands on them, that's battery. Like that is just simple as is. And even your words. So you got to remember what you say. So you have to put the relief. And like I said, this goes back to the Maslow's hierarchy of care. So then vital signs. These are important. I have found that a lot of newer nurses don't understand that you take vital signs, you're responsible for them. So if something is off, what are you going to do about it? So if their blood pressure is high, what are you going to do about it? This is the critical thinking. The first thing you're going to do is, oh, if it's high, I'm calling the doctor. No. You're going to look at the orders. This is part of the morning assessment that you're going to look at the orders. Okay, my patient has blood pressure medicine. So I'm going to give the blood pressure. Then in a couple hours, you're going to repeat the blood pressure. If the blood pressure is not down, then we're going to contact the provider to say, hey, blood pressure was this. I gave this medication for blood pressure. I repeated the blood pressure X amount of time later, and this is what it still is. What would you like me to do? And that is when you call the provider because they have medications. This is you using your critical thinking of what you need to do. You don't need to just call the provider. Blood pressure's high. No. The nurse, what are you going to do? If they don't have any medicine for blood pressure, yes, then you're going to call the provider and say, blood pressure was this. I don't have any medications for high blood pressure. What would you like me to do? Okay, assessing pain. This is the 5th vital sign that we go over. And these are the questions that you need to ask. Orientation questions, pupil check. So you have your pen light with you, your neck veins, patient up at a 45-degree angle, and you're checking. This is very easy to see. This is something you can start doing. I tell our students is you walking into the room, you're already doing your assessment. You're going to find you're going into like the grocery store and you're going to stop and watch everybody around you. It's amazing all of a sudden that you turn around and you're like, wow, they got swollen ankles. You start assessing and then you start thinking, going, okay, is it the right ankle, left ankle? Okay, left or right? Oh, do they have congestive heart failure because our blood flow flows down that way? So you'll start seeing. So it's just observation of a lot of stuff. But When you walk into the room and you go to the end of the bed and you say hi to the person and you go to one side and the other and they're following you and tracking you, you're going to start to see that their eyes are equal, they are accommodating and everything else. So you'll start to do assessments without even the patient knowing that you're doing assessments. Just like when you're taking your vital signs and you're trying to get the respiration, you're sitting there. So like if you're listening to the heart, then you're going to turn around and do right into the respirations. All right, so bilateral pulse checks, this tells you that. Then the breath sounds, you're going to listen anterior and posterior, front side, the back side. It's so here, anterior, and then in the back. Okay, and what do you hear? Vowel sounds, you're going to inspect first, then you're going to listen in all the quadrants. The easiest way I say is like, you have a little X here, and this is where the navel is. So then you're up in the quadrant. So always watch where you are and try to get into the middle of it. Because I find a lot of students are down here, and then they go lower, and you're all in the lower abdomen. You're not up. So just think of like the belly, the navel, and then the nipple line. That's where it is. Some females, you have to get under their breasts. Some women have bigger breasts, so you have to get underneath it. And sometimes you have to say, I'm going to get a little personal. I just need to listen. Then you're going to palpate, feel. And then during this part of the assessment, I want you to have in your head that when was the last time you moved your bowels? Because if they haven't moved their bowels in 2 days, we need to do something about it. Is this normal or not normal? So I always say when you're doing bowel sounds, that's when you're going to go into the GU2. When was the last time you urinated? Have you had any problems? So that is when you're going to ask the questions, and then you're going to write it all down. All right. And then skin breakdown check. You're going to check everything. And this kind of goes down into it. The turgor, checking the turgor on the sternum that we talk about, or the back of the hand, colors, capillary refill. That is very important. Make sure you're checking that. Then you're going to have the closure, finish up with the patient. If you have any questions, is there anything I can do for you before I go? And then make sure that the bed is down in low position. The side rails are up. The collet is within reach. And then you leave. All right, so that is part of it. And then here is the vital signs. And then you got your eyes and nose. This is going to be at the end of your shift. You're going to put this in the computer. But if your school wants you to do everything on paper, you do everything on paper. This is just where you start writing things down. This is the center, the patient's age, initials, their code status, and their diagnosis of what they're here for. These are labs. These break down right here, these 3 things. There's some more, there's a lot more. I do include them in the New Nurse Navigator so you can see them, but that I found. But these are the 2. So this is for the CBC. So you got white count, H&H, platelets. Then this is for the BNP. So you have sodium, chloride. Oh my God, I can't think. Sodium, potassium, chloride, CO2, BUN, creatinine, and then this is for glucose. This triangle up is for PT, PTT, INR, and if it was flipped, it is for MAG, FOS. There's different ones that they have and there's so many of them, but these 2 are the basics. Reason why I want you to start to get into the habit of looking at like this and writing it down like this, because when you start reading providers, H&Ps, notes, or whatever, they're going to pull it and it's going to be in this form. So you need to know if they just filled out this part right here, you're going to know that's the BU and creatinine, and we're worried about their kidneys. The kidneys are off. Is this a chronic kidney disease or is it acute kidney disease? If it's acute, what fluids are there on? Hypertonic, hypotonic, what kind? And then you need to know how it's going to affect the patient's body. Okay. This whole side, right side here, this is where the nursing diagnosis and interventions and patient teaching. This is the part I always have students really focus on because it helps you with your thought process and putting everything together. So interventions, what are we going to be doing? So you're going to have your NANDA book. There's a new one that's coming out. You can purchase it. But this is where the nursing interventions, what are we doing for the patient with their diagnosis of whatever they have? Then education, what are we teaching the patient? This is so important that you're documenting. Wherever you are, there's a special spot for education. In there's the same things I always educate my patients on, and I write them. You taught your patient about the call light, you need to document that you told them that. It's not something that's just assumed. You did it. No. We need documentation. We need proof that you did that. And that is how you're going to prove it, to say, I taught this patient. And then it's, do they understand it? That's the other thing. We're teaching now at a 3rd grade level, because the average person out there with having a secondary language, they don't fully understand the concepts of stuff. So we have to sit there and bring it down to basic levels so everybody gets it. And don't make it more difficult than it needs to be, but this is like whatever your diagnosis. So with the diagnosis, I always say you need 3 of them. You need a primary, you need a secondary teaching, and then you need a risk, at risk for. And this could be for anything. So we can talk about pneumonia. So we got RT, so impaired gas exchange related to, high CO2 levels as evidenced by low pulse ox, at risk for infection. And then your teaching is a knowledge deficit. They have a knowledge deficit. They don't know. So in your book, you'll start to see that. And you might have a little book that the school gives you. I actually have a bigger book. See if I can find it. Actually, I'm not sure where it is. My office is a mess. All right, I'll look at it for another time. If you're actually really interested, just leave stuffs in the leave comments. And don't forget to give this video a thumbs up or thumbs down. If you don't like it, give it a thumbs down. I like to know all comments. As I teach, I say no question, no nothing is a stupid question. And if you don't like how I'm teaching or what I'm saying, it's okay. It is okay. So anyways, this is a concept map of what I like to have to give students. So if you would like a copy of this and want me to help you go over it, just leave your comments at the bottom. I just want to say thank you for taking the time out of your day to listen to me. If you have any other questions, like I said, I want to hear them, and I hope you have a good day.